Of the coronavirus are rising across parts of the country and right here in the tri-state. Some bars and restaurants in Evansville had to close after reopening because someone there tested positive. Plus, there are fears tonight that some people taking a vacation out of town could be bringing the virus back home with them. Earlier today, I talked with Dr. David Schultz from Evansville Primary Care to find out why cases in the tri-state are going up. Dr. Schultz, thanks for joining us tonight. The number of coronavirus cases is on the rise in many states across the U.S. Here in the tri-state, Evansville and Vanderburgh County has seen over 20 new cases almost every day over the past few days. And in Kentucky, Owensboro and Davis County is also adding several new cases every day. Why do you think that we're seeing this spike in new cases right now?
Well, Brandon, I think several things are in play here. First of all, we're not seeing the number of people out in the tri-state wearing their mask like they were. And it's very important when you're out at a convenience store or at a store to wear your mask and so forth. The second thing that's happened is people have relaxed a lot of their social distancing. So we're going to places and different places now. And that's playing a huge role in this. Now, whereas we're seeing the spike in new cases and so forth, we're not necessarily seeing the devastation to those individuals that we were seeing back a couple months ago.
That's some good news there. And the big news out today is the West Side Nut Club has canceled this year's fall festival. Obviously, that's a major decision that they had to make that will affect several local nonprofit agencies. And that festival, as you know, draws thousands of people every year. From a medical standpoint, was that a good decision to make?
Well, Brandon, that had to be a very difficult decision to make. And I know that the folks out there did not make that decision very lightly. They put a lot of thought into it, but they made the right choice, unfortunately, for us, but fortunately for the tri-state. They made the right choice. And the reason is because at a festival like that, you're attracting thousands of people in a very small area. And when you have that many people in a small area, it's much easier to cause that virus to be spread to a larger group of people, which in turn can spread it to other people rapidly. So they made the right choice.
And some bars and restaurants and even a hair salon in Evansville have closed again for a few days because someone there, either a worker or a customer, tested positive for the virus. Do you think we're going to be seeing a lot of this opening, then closing and reopening again?
Brandon, I think we are indeed going to see more of this closing and reopening several times during the next several months. And part of it is we have to be very honest with ourselves. If we have COVID-like symptoms, that would be cough, congestion, body aches, fever, feeling malaise, which is tiredness and achiness, we really need to stop what we're doing, get checked, and then return to work only if we know we're negative. For those individuals who are just chancing it or risking it, it places other people, unfortunately, at risk, and we need not do that. So this is unfortunate, Brandon, but I think we're going to see more of this.
Now, if someone decides they need to go out somewhere, how can they protect themselves while out in public?
Well, again, Brandon, first of all, make sure that they're not exhibiting any of the symptoms of COVID-19. That's the first thing. Second thing is make sure that the hands are being washed very carefully before and after going out. And then the third thing is wearing that mask. It's still important to wear that mask when you go out in public. I know in the larger cities, such as St. Louis and Chicago, even places like the zoo, which is outdoors, they're insisting that everybody wear their mask the entire time they're in the zoo, even when they're outside. We need to continue that kind of a practice until this thing has cleared or until we develop a vaccine and an adequate portion of the population is immunized.
Is there a fear that some of the new cases are a result of someone going out of state, possibly on vacation, getting infected while there, and then bringing the virus back home with them?
Well, Brandon, that indeed is a risk. And again, for that reason, we should limit our travel away from areas where there's a higher number of people with coronavirus. And those are your major metropolitan areas. Your major metropolitan areas is where we are going to see higher cases and higher incidences of COVID-19. And so we would recommend not traveling to those areas. And those states also that have higher numbers of COVID-19, we should also limit travel to those states until the numbers start clearing out.
Now, I'm sure you saw the news over the weekend that a 41-year-old man in New York City who was an actor on Broadway died from coronavirus complications. He had been sick with the virus since April. I have not heard of someone before being sick with the virus for that long. Have you heard of other cases similar to that?
Brandon, we have. And indeed, his case is tragic. Everyone in America was rooting for this individual to pull through. But the COVID-19 virus does not devastate everybody like that. A few people it does. And in this individual's case, he was devastated by it. It caused tremendous amounts of damage to his lung and the architecture of the lung. And it caused systemic problems with this man's body. In those cases, a lot of times, despite our best efforts, using a ventilator, using full life support, even in those cases, there's some tissue in our body that cannot be healed. And that's unfortunately why he passed.
Well, we've talked about this a lot before, and as you said earlier, the face mask, wearing them protects us and others from getting the virus. We've talked a lot before here on House Calls that some vitamins and supplements we can take can actually help protect us from getting the virus. What are those?
Well, Brandon, there are several things that I think one should take. If you're exposed to this, you should take higher amounts. But what I would recommend right now, especially with the increasing numbers, vitamin C, 500 milligrams every day. If you're exposed to someone with COVID-19, then 500 milligrams twice a day. I would also recommend over-the-counter zinc. Zinc has been shown to be very effective in this. And then I would stay away from echinacea. Echinacea has not been shown to be very helpful with all this, but certainly zinc and vitamin C have been helpful. And there's some studies to indicate that vitamin D in the order of 1,000 to 2,000 units a day has been helpful.
Some great advice tonight. Dr. David Schultz with Evansville Primary Care, thanks for joining us tonight.